Um, Welcome everyone. Thank you for joining us. And we have a few little notes in the slide that hopefully you can see. You've been muted upon entering the meeting. Just make sure you keep your audio and your video off just to make sure the webinar goes smoothly. And if you have questions, you should be able to submit these using the chat feature in the toolbar, and you'll be able to submit questions to the host. Thank you for joining us today for a CHET conversation supporting COVID-19 caretakers featuring Candace Henley, Chief Surviving Officer of the Blue Hat Foundation. A few things to note. Again, you've been muted upon entry. Just keep your audio and video muted. Before we get started, I encourage you all to RSVP to our upcoming CHET chat on May 19th. We will be featuring Dr. Andrew Papachristos and on his work with gun violence prevention. Also, please try to check out our Skinny Trees podcast if you have time, where it's available on Apple Podcasts or wherever you listen to podcasts. And you can live tweet using the hashtag #LiftHealthForAll. Candace is an accomplished executive director with significant experience in community outreach. Community outreach and patient advocacy. She has a superior record of successful community service and engagement. Candace is a 16-year colon cancer survivor who shares her story of a challenging battle with a positive attitude and faith that inspires others never to give up. Her greatest fight was against the financial toxicity of cancer and the tragic turn of events that her life took after her cancer diagnosis, which overwhelmed her, robbed her of hope, and tested her faith, and threatened her with defeat. After years of advocating, Candace identified a need for grassroots awareness and education of colorectal cancer in minority and medically underserved communities, and started the Blue Hat Foundation in 2015. The organization utilizes community partnerships with healthcare providers, physicians, and hospital systems to deliver the message of the importance of early detection, knowing your family medical history, and free screening. Out of those efforts, she created a faith-based colon cancer awareness campaign, Blue Hat Bow Tie Sunday, now in its 10th year. Welcome, Candace Henley, and we'll have Samantha start off with a few questions. Please note that we'll have our Center Director, Dr. Melissa Simon, joining shortly. But welcome, Candace, and welcome, Samantha.
Thank you. Thank you. Thank you so much for having me.
Thank you so much for joining us, Candace. We're really excited to hear your story and hear more about your experience. Could you start by telling us about your role as a caretaker and how COVID-19 has affected your situation?
Okay. So my mother, I've been a caretaker for my mother. And initially she thought she had a cold. My mother was diagnosed with Bell's palsy in December 2019. And so she just assumed that she was having, symptoms of related to her condition. And so it was because it was very, very mild. So she just didn't really think much of it. And so after a couple of days, when the symptoms just didn't seem to go away and they seemed to get a little worse, she was like, well, maybe I need to get some more cold medicine. The traditional thing, is always self-medicating. And at that point, I was like, you know what? I think you need to reach out to your doctor because COVID-19, coronavirus, and you just had a cold out of nowhere. And so that was a concern, and especially since her Bell's palsy. So she reached out to her doctor, and within 2 hours, they had 2 nurses come to her home. And they did the test, they covered up, and one nurse came in, did the swab, and then took the sample out to the nurse that was waiting outside, and gave directions for what my mother needed to do to shelter in place. During this time, we had to figure out how I could work with her in terms of getting her prescriptions, her medications, and without infecting myself, because I'm at risk as well. And so, but prior to, I had just come back from London. So I was concerned for her when I came back because I didn't know. And so I had been wearing masks on my face because I wasn't sure whether or not I was affected because I just come back from London. And so having had that practice in place, we just continued. And so she would wear a mask and I would wear a mask. And going and then just running errands. And she was so sure that she didn't have it, but we were still, she was like, oh, I think I'm fine. I think I just have a cold. I think it's just sinus related. And so we got the positive result back April 9th.
Thank you for sharing that. Considering all those things and your personal experience, what do you think are some of the immediate needs of your community and of cancer survivors and the people you serve related to COVID-19?
Well, it wasn't when this all started, there was a lot of conflicting information, and it was kind of mining through information between the CDC, between the news reports, between the Department of Public Health and everything that was going on. So we were kind of mining through it. For us as cancer survivors, as with anything else that happens, it's very important that we ourselves cover up. And one of the things that I was in practice of doing, I would cover up when I went out, and I would have gloves. But then when I would come back in, I would take everything off at the door because the information is so fragmented. You don't know exactly how you get it. You don't know if you stepped on something, you don't know. So I wanted to be sure not to track anything as much as possible past my door. And then immediately go in, wash my hands, take off my clothes, and change my clothes, and then wash my hands again, and then also wash my face with antibacterial soap. So all of this was something that I wanted to be careful to not track and pass on and not take it around, around my home. So I think with us cancer survivors, we need to also make sure that we are maintaining ourselves physically and mentally. One of the things I appreciated was the fact that there was a phone call from the care center with a psychologist that asked how my mom was doing and how I was doing. And so I think that's a very important piece to caretaking with someone, because it's been an emotional ride. It's been a very emotional challenge.
I only imagine.
Yeah.
And so you talked about some of the special precautions that you've taken to keep your home safe. What are your special rules for any other family visitation during these times?
Well, one of the things we were sure of, we put together a group chat because we did not want other family members to come in. I was already, exposed to her. So we wanted to limit anyone else being exposed, and we want to limit, us, or me exposing someone else or anything. So we kept the family at bay, and we continued to do video chats. We have a Facebook family group page where we kept the family updated about her condition, what the doctors have said, and what she's been taking and how she's been feeling. So we've kept a daily chat that we thought was very important. Also to keep my mom engaged, because she had gotten depressed for a moment. She was very, very concerned about it. Her initial reaction to being diagnosed with COVID-19 was she was devastated, and she was extremely scared. And so one of the things that I had to tell her was the same God that we were praying to before you had your official confirmation is the same God we're going to continue to pray to afterwards. And that was just to make sure that we gave her comfort in knowing that, when no one knows how we're going to respond to this. And so, and the other thing was to keep everyone from giving her information that they saw or read in a newspaper and on television. And then I also had to, ask her to stop listening to the information, because every day it was a statistic as to, as to how many people died. And that was, that was concerning to her. And so having these daily chats and, and calls with her kept her kind of centered so that she wouldn't focus so much on what's been reported. So that was how we were able to, together as a family, keep everyone else from coming to her, but also staying connected with her.
Certainly is a time of information overload. There's constantly news about it. And with social media, I can only imagine how hard it is to even avoid receiving so much of that information. So what are some other things that you and your mother have been doing to manage your anxiety around this?
Well, we also, so I gave her a series of meditations to listen to, and also Bible scriptures, because we're comforted by our faith. And I wanted to make sure that she had a balance between meditations to relax and calm her nerves, but also, making sure that in conjunction, we maintain faith and understanding, that God is our comfort at the end of the day. Whatever, we all have our time, but, it doesn't mean that this is your time. So we wanted to keep her comfort that God is always with you, and so that, and to draw comfort, in faith and knowing that you are loved and you are cared for, and that we are here to support you. And then just talking to her every day and finding ways to make her laugh. Because, my mom and I kind of have this really quirky relationship that, it just doesn't take much to make her laugh, but, just finding ways to keep her from focusing so much on what was reported on the news. And then even things that we saw on the news, we had to find a way to flip it so that she focused on the positive and not on the negative, and then also gave her some movies to watch. I mean, we had to figure out creative ways to kind of keep her focused and grounded so that she would not continue, because when I tell you the news and she read everything. And so I had to finally say, Ma, stop. Stop. Let's focus on, this is not you, so let's not focus on that. Let's get you centered on what is it that you need to do. And so so then when I said that, I don't know why I said that, because then she gave me a list of things to do and grocery shopping, but which I was happy to do, because then that let me know that she was moving beyond the concern and started trying to find a new normal during this time.
And it sounds like she had fortunately a surprisingly easy time accessing a test, which is great, because I think that we often hear about how hard it is to access testing. So with the limited testing capacity, were you also able to get tested, or do they have any sort of procedure for testing caregivers that are living with people who have COVID-19?
No, there weren't any procedures, except, well, I don't live with my mom, but I was visiting, and when she was diagnosed, the thing that people didn't know, and that was never reported, that I didn't hear, was that seniors, if they felt, if they were feeling ill, the medical, they would come to you. So someone from the medical office would come to seniors. So that wasn't information that we knew. And so when she called her doctor, and she says, great, we'll send someone out. And we were very surprised at that. And I did share that with some of the people that I work with in my network, that seniors can have someone come out if they're not mobile. And so we were happy to hear that, but it was never asked if there was someone that you were close to, or that, you know, you've been in contact with to be tested or to come and get tested. So I had to do that on my own. And that was a challenge. Yeah.
Tell us a little more about what your experience was with seeking testing yourself.
Well, one of the things, because I didn't know where to go, I didn't know if I should call IDPH, if I should call, but I never had symptoms, and that was the issue. When I called, I was asked if I had symptoms, and I said no, and you know, and they were like, okay, had you been exposed? I said I've been around, and I explained that I just come back from London, that I had been covering up, and that I was exposed to someone that had COVID-19. I was asked if I had symptoms, and I said no. I was asked if I felt ill. I said no. And they were saying, okay, well, at this point, we don't think that you need to be tested. But if, you know, if within the next 24 hours, you feel ill, or you feel as if you're having symptoms, to call your doctor. But no one ever came to test me.
So you weren't able to get a test?
No.
Yeah, it sounds like too far common of a problem. And so when you established that group chat, with your family, did you have any issues with all getting on the same page about what applications to use? I've heard a lot about different communities have a preference for different platforms. So not everyone necessarily has the Zoom app or different applications. So what was that like, establishing your method of communication?
Well, you know, so the funny part about this is well, I'm the go-to person in the family. So it was pretty much whatever I established is what the family went along with. And my aunt, my mom's youngest sister, also, you know, is engaged, but they pretty much followed my lead. And so, and my daily activity was to research, watch the new, you know, and I was already watching it anyway because of my involvement with, you know, with cancer patients, but I also had to look at it in a different lens because it was now personal. And so I had to look at the information in a personal lens to see how it applied to my mom, how it applied to any care that she would need to receive. And if she, you know, and if she progressed worse, what did we need to do? So I was putting a plan in place just so that if something progressed, we were ready and we were prepared. And so with doing that, it was just watching watching the news daily and deciphering the information, but also being on the calls with the various hospitals and getting the information as to who was, you know, what treatment was being suggested or tested at each hospital. So I knew that Rush was working on one medication, University of Chicago was doing something else, and Lori was doing something else. So I was keeping up to date so that I could find out who was doing what and what was going to be the best avenue for her.
And I think that from your experience that you are probably someone who is much more familiar with patient rights and how to advocate for yourself. And so what do you think are some of the challenges that people are facing right now in terms of advocating for themselves in the medical systems? And how has this experience furthered your policy change advocacy?
Well, you know what, right now the medical system is they're high on stress. And you're getting where patients are trying to get information, but they can't. And they're being transferred from one person to the next person to the next person in some cases. And that's stressful for the patient because they're like, I'm trying to get information, but the medical community, they're trying to, you know, decipher and do what they do with the COVID-19 and get information as well. And so it's kind of like a clash of, okay, we have all of this information, but right now we're kind of busy and we're trying to get this, you know, and then so it's like, call the Illinois Department of Public Health, call the Chicago Department of Public Health, call 311, call your doctor, call this. And so it's a mixture of information and it's challenging. And so for someone like me who has had that experience, which is what I went through in my own personal journey, it's challenging. And so I kind of, when I hear of, the patient community having this experience, I try to give them the information that I have to kind of assist them with it. But I think what is happening, there's an overload of information, but not enough direct information. And I think that's where the challenge is becoming, is that we don't have enough direct information from beginning, middle to end. And so when it comes to that, we don't know where to go and we don't know who to talk to or who we should engage with. And even with our own primary care physicians, it can be challenging to reach them as well because they're also in the middle of this crisis. So we're waiting to figure out, okay, they said they're going to call at 2 o'clock. It's now 5 and I haven't heard from anyone. And so should I call? Should I call back? Should I not? So I think the challenge is that the information is hard to gather and hard to follow. So if there was some type of clear cut, this is where you start, here's where where you are, and if you're right here, here's where you should go. So I think there needs to be some more information that is clearly defining the steps on where to find the information, where to start. If you don't have a primary care physician, where should you start? If you have a primary care physician, this is what you should say. So I think that's where the challenge is.
Related to that, how can someone keep in touch with their doctor or clinic on a regular basis for regular health checkups or any other specific concerns, especially someone who either has pre-existing conditions or is currently pregnant or has a reason that they need to frequently visit the doctor regardless of what the circumstances are outside?
Yeah. Well, the challenge has been is that not everyone is able to do telehealth. And especially in low-income communities, they don't always have smartphones. And so it's a challenge. And so I think for the medical and the patient community is that it needs to be communicated as to what type of communication that patient has and what's available to them. And if that patient doesn't have communication, who is the next closest person to you that we can get information to for you to reach out and reach back to us? And find out if, especially with some of the phones now with some of the plans on Medicaid, they're only able to have like 250 minutes a month. So they may only be able to text. So I think in terms of communication, we need to think outside the box. So if that patient can only be text, then there has to be flexibility within the physician community to say, okay, I need that this patient can only be text, let me send a text. And then once you send the text, ask for a confirmation of receipt of the text. Don't just send a text and say, hey, this is your doctor, give me a call. Ask for a confirmation. So therefore, they know that the patient did actually receive the text. And then if that's not, and if they have an email address for, for communication, have that patient provide an email address. And then for those that have telehealth or that don't actually have the ability to, they have a smartphone but don't have the ability to do telehealth, but can talk, make sure that they're able to have communication via the phone so that, they can stay in contact and set a set schedule of communication to keep in communication with that patient, either with their nurse or, with someone in social services, but someone that's able to stay connected with that patient and ask that patient to give me a call and follow up on Friday, and to make sure that if that patient hasn't called on Friday, call that patient on Monday.
In your own situation and the situation with your mother, or perhaps any community members that you've spoken with, are you seeing healthcare providers provide that flexibility, or is it something that you have seen people have to advocate for themselves to get that?
Well, to be honest, they're trying. So and normally I usually take this opportunity to kind of ding, the medical community. However, what I've seen is an incredible show of compassion and concern for the patient community, and a sense of truly wanting to know how, outside of what they've already done, how can we, as as a hospital system, as a cancer center, engage with our patients? How can we creatively have communication and stay in contact with our patients? And so with that, I've been incredibly happy, and really willing to support as much as I possibly can, because I felt as if this is a great opportunity for me to take what I've been doing and share and say, let's try this and let's try that. So yes, I think there has been an incredible show of support and concern on how the cancer centers can extend to the patient community and stay in contact and in communication and help patients during this time of crisis.
You mentioned that this communications issue can be a huge barrier. What would you say are some of the other most significant challenges for low-income, minority, or other medically underserved populations that are trying to navigate healthcare right now?
Access, is always an issue. Access to information, access to transportation, knowing where to go. The information is, again, it's so fragmented that it's hard to find. And prior to just a couple of weeks ago, you didn't know where to go, and it wasn't as easy to access the locations for, and especially if you don't drive. And so I think the challenge for low income communities and minority communities is having testing within their areas where they're able to get to. And so, and where that information and disseminating that information is a challenge, because, again, you're watching on the news where you're seeing testing sites that are in the, suburban areas on the north side, and certain areas on the south side, but not in the areas where there are high rates of COVID-19, and not information on where to access testing in these areas. So that has been a significant challenge, and understanding, and then information explaining who should be tested, when should be when you should be tested. Again, you're watching this information on television, and so it's so much information that it's like, okay, so should I get tested or should I not get tested? And and where can I go? Do I have to get on the bus and go all the way to the north side? Is there testing at my hospital? How can I get a test? And then there has been where they've gone to the certain hospitals to get tested and were turned away. So that's the challenge. And so then when they're saying, okay, well, I was turned away, now what do I do? And, and just in my case, if you're not having symptoms, then it's like, well, once you have symptoms, give us a call. So, the information is like, okay, so I don't know what the symptoms are. And then of course you have the information about those being asymptomatic. Can't get tested, so you don't know whether or not you're a carrier. So I think that's a big challenge in, with that information. How do we get tested when we are trying to get tested and they're turning us away because we're not having symptoms? So I think that's a big challenge. And I think that's a confusion. That's a big confusion factor there.
I'd agree with that. And I'd say within the Center for Health Equity Transformation, we've had some conversations around the messaging and what might be effective or less effective. And so, for instance, most of the messaging is currently coming through the news from government leaders and public health leaders, which may not always reach all the audiences that need to be reached, especially the most vulnerable populations. Who do you think needs to deliver those messages, and how, for some of those communities that are harder to reach and maybe aren't watching the 9 o'clock news every night?
Well, one of I think we need to make sure that information is funneled through churches and community organizations that are, and especially FQHC centers, because this is where the community is going. That's where they're getting their care. Some patients don't have primary care physicians. And so we need to take the information into the community where the community, where they go. They go to church, if there's a store, such as Jewel, if they're going to Mariano's. This information needs to be where the community is going to get their services, to get their prescriptions, so I think, that information needs to be funneled just a little bit more. Even, I remember when I drove a bus for CTA, there used to be information that if someone wanted to put information, they could put it on the board on the bus. So I think also putting that information and working within the transportation and putting that, in the buses, what is also helpful, because most community members, they're on the bus. Yeah.
Thank you for sharing that. I see that our faculty director, Dr. Melissa Simon, just joined. Melissa, would you like to jump in with some questions?
Oh, no, you keep going. I'm sure there's some questions in the flow, but absolutely, I agree about being able to post information on the bus and the train. There's people living on the train and in the train stations right now, and they don't have masks on, and they need stuff. And if we're going to require people to have protective equipment or things to protect their face, we need to have a whole shift around that, right? A shift in mindset about what this means when you cover and you already have maybe different color skin or you look different, and what that means for racism and discrimination and the cops being called on you for, because that's happened around the world, the nation right now, and in our city. Yeah. And then, if we're going to require the masks, we need to give them out.
Yes.
And that brings me to my next question. So there have been, unfortunately, a number of myths that have circulated about COVID-19, especially among communities of color. And yes. So what myths are you familiar with? How have you seen them circulating? And if you could talk to the people that are circulating those myths, what would you say?
First, I would, it's maddening. First of all, it's just so sad and heartbreaking, that we continue to spread, wrong information and bad information. And one of the worst things I've heard is that, that African Americans can't get COVID-19, and it is like, where did you get that information from? And that is so not true. And even young people, even my youngest daughter, she's 21, and she's working at Target. And I went to Target and I saw her. She didn't have gloves on and she didn't have a face mask on, even though they had the plexiglass. And I said, where are your gloves and where's your mask? And she goes, oh, I have hand sanitizer. And I just lost it in Target, like that doesn't, I was like, if hand sanitizer was the cure, we wouldn't have all of these people diagnosed with COVID-19. And I think that's where young people are confused with the messaging, because we're saying, have hand sanitizer, keep hand sanitizer. So they're under the impression that having hand sanitizer is going to prevent them from having COVID-19. And so I think that needs to be cleared up a little bit more, that is not a cure and it will not keep you from getting it. And spreading that, and I think that's why people have gotten comfortable, is because the messaging is just not so clear in terms of how you do this. Yes, wash your hands, yes, have hand sanitizer, but I also think that it needs to be stated that that does not prevent you from having COVID-19. And although we think that common sense is common, it really is not, because if it were, we wouldn't have these parties that we've been seeing, in the backyard. I just saw the other day about the, 1,000 people, and we wouldn't have that if messaging was extremely clear. And I think sometimes we need to have the worst case scenario put out as to how far this can go. And I think the imaging that we've been seeing on television has not represented the minority community very well, because we're seeing either older white people, middle-aged white people, or other, and when you have seen a younger person, white. So if the messaging is not relating to Asian community, Latinx community, or the African American community, why does it pertain to me? Because you're not showing these images that I relate to. So no, we don't get, so then it justifies, oh, well, no, we can't get it because it's not showing on TV. You know what I'm saying? So I think that we have to be very intentional to make sure that the representation, that we see does reflect communities of color, and other minority communities, so that we understand that, yes, this does pertain to us. And the messaging that COVID-19, having hand sanitizer does not prevent you from having COVID-19.
Thank you for sharing that. Before I ask a couple more questions, I just want to encourage anyone who is currently on this meeting, if you have questions, please send them through the chat to Araceli Estrada or Ivy Lum.
Can I ask one question?
Sure.
Yeah, hi, Candace. So, what was I gonna, no, can I ask? That's great. No, there are people on this call, including myself, that really, like, you have the Blue Hat Foundation, and what can we at a place like Northwestern or another academic health center, what can we do to help you reach more people for you through your organization? Because like people living with cancer right now, I deal obviously with pregnant people as well. They're real scared. They're putting their treatments on hold. They're deferring screenings and all that. But the ones that have cancer are real scared about coming in. So what are some things that we can do to help you?
So one of the things that we've been in discussions about is trying to do check-ins. And what we wanted to do was schedule a patient check-in. And a lot of times patients feel disconnected, but they also, of course, they're having fear, but patient check-in would look more of patient-to-patient support, where we would talk, we have Zoom, so, we can have, set up a Zoom conference call where patients can call in and we can all talk together and just say, hey, how's everything going? What, how are you feeling? What's happening? And I would love to have someone that is in psychology to be on the call, to be able to talk with us while we're having these check-ins, to say, well, let's talk. Let's see, what are you experiencing? So therefore, there's a comfort there, and then and that also reduces that patient anxiety. But but that patient-to-patient peer support is very important. And so having that, and not so much just having with the medical community, but having patient and patient together discussing it, so that we all see each other and go, okay, well, I'm not by myself. You felt the same way too. And I think we have a lot of anxiety with patients, and they just need to commune with other patients as well. So having the support, of Northwestern, or we're facilitating the calls, and then having someone on the call in psychology to say, what, I'm here to answer any questions, to offer suggestions on how you can relax, you can calm down, deal with anxiety, deal with stress, and offer any other support that, Northwestern may have within psychology to help patients.
Thank you for that. What about other things like helping with transportation to the hospital visits, masks, since we're talking about masks?
Most definitely. Well, one of these too, we're getting a shipment of 200 masks coming in from one of our partner organizations, Fight CRC. So I'm happy about that. And we also have masks, but I mean, 200 is, is just 200. So, but I think if, more masks we can get to pass out to the patient community, we would definitely love to have that. And I think right now we haven't had any requests for transportations at the moment. And that's because most patients are staying home. They're so afraid to come into the hospital. One of my patients that I mentor, he is a stage 4, 3 times stage 4, and canceled his surgery out of fear. And so they're going to maintain him on chemo until this passes, because he just absolutely refused to go to go into the hospital. So that's why I think this patient support is very important. And having the ability, because and patients don't have the ability to talk to someone in psychology. They don't even know who to talk to. They don't know that there is someone that they can talk to help reduce their fears.
Thank you for that. Just one more follow-up on that then. So are there messages or things that we can say, like at a Northwestern Cancer Center, for example, that could help people like that stage 4 survivor convince him that it's safe to go in the hospital? Or, you know, is there something that we can say and do, put out there, video, put out whatever it is to help?
Absolutely. Absolutely. I think messaging around in the patient community, because there is not enough information for the patient community. Of course, it's being said, well, you know, this is the safest place to be doing right now. But how do you convince that to a patient when they see that you're running back and forth, with an emergency with COVID-19? So yes, I do think that messaging from, the cancer center and from the hospital itself saying, it is safe for you to come, to continue treatment. And, and if you would like to talk to someone about your concerns, here's a number to call. And I think it's very important to not have a voicemail, but to have a live person, because I think right now, patients and, people are nervous. We just developed a coalition of other colorectal cancer organizations, and one of the issues that came up, one of the requests that they wanted to do was to do another landing page of information. And to be honest with you, I don't think that right now anyone needs another landing page of information. And if it were me, don't give me another piece of paper or another landing page or another phone number. I want to be able to engage with a live person that can give me some type of information that I can, it's tangible. I can talk right now. And I think that's what's important with the patient community, that they have someone that they can speak to right now. Not a voicemail, now we do recognize that there is there may come a time where they might not be able to get a live voice because it might get extremely busy. But I think it's important that instead of saying, we'll get back to you within 24 hours, we'll get back to you within a 2-hour period. So that it's a comfort knowing that someone is going to call you back sooner rather than later.
Thank you.
We have an audience question that says, do you feel that there should be messaging on how to properly use gloves? Because a lot of people create more cross-contamination by not using them properly. And I'll just add to this is probably true for masks too. So what are your thoughts on that?
Oh, absolutely. Because I had to, I had to look at a video myself to make sure that, how do I take the gloves off without, messing up? I mean, when it comes to dyeing your hair, it's a totally different thing, but this is totally different. It's like, how do you take this off? Because then you become fearful because, you start to panic. Because I think I had a panic moment at one time where I was like, I think I can see the germs on my gloves, because you're like, because when you're dealing with it, so much that it goes through your head, you start to panic because you're like, did I take the gloves off? And I think I had a moment where I just took the gloves off. I didn't think about how I did it. And I took it off and I had a panic moment and I ran to the bathroom and I think I washed my hands for about 5 minutes with antibacterial soap. And I just kept washing my hands because I was so nervous that I didn't, know. And then I touched my face. And so that was a panic moment for me because I'm like, oh my God, I touched my face. I took my gloves off. And then I was like, did I take my clothes off by the door? So so I think, yes, it is important to have a video that teaches us how to take off the masks, how to put on the masks, how to take off the gloves. And then how to manage once you get inside, inside to home, how do you manage the clothing that you've just taken off? Because it's not always feasible to take off your clothes and run it to the washing machine, and that's the messaging that we've been saying, take off your clothes and run it to hot water. That's not always feasible. So how do we deal with that?
Right. What if someone doesn't have a washer and dryer in their home, which I think
Right.
is really common for a lot of people in the city of Chicago, especially.
Yes.
And so Melissa had brought up the issue of people of color may experience racism and discrimination when they wear a face mask. And what do you think needs to happen? Maybe what kind of partnerships need to be formed? What needs to happen to prevent people from experiencing that when they wear a face mask?
You know, that's a huge undertaking, because it's going to happen, period. And that's just the way that the city has dealt with the minority community and has dealt with the Black community for years. This is not something that's going to change because we put messaging out. It happens even without having the masks on. I think the best that we can do is continue to say that everyone that has on a mask is not here to rob you. You know, but it's going to happen. I've even experienced it having a mask on and walking through the store. You know, is there anything that you need? Yeah, I'm here to shop. That's what, you know, yeah, I'm shopping for it, you know, and it kind of felt like I was picked out when there were other people standing around me, but they were never asked if there was anything that they needed. So I think this is going to continue. That's just the way the system is set up. And this is going to take an undertaking of civil rights leaders and, you know, community leaders and, and churches. And this is going to take on a whole new policy stance. So I think that's where the challenge is going to be, is who do we gather to say and to fight for this? And it's an uphill battle because it even happens when there's not a pandemic. So I think that the challenge is going to be, who do we talk to? Who's going to take on this charge? I'm always willing to take on a fight, but I'm limited in my power, but I will use my voice as much as I possibly can. But the question becomes, who's going to stand with me? And who in policy is willing to take this on to champion this? Because that's where it's going to have to go. And where, and you know, will the governor be willing to take a stance with us? I'm sure Mayor Lightfoot will be willing to take a stance with us, on the subject. However, who's going to say, hey, we need you to say something, and will they listen? Yeah.
That would be the important part, right?
Yeah.
We have a clarification to the question about the proper use of gloves.
Okay.
So they were asking, what about the messaging around what you touch when you're wearing gloves, so such as keys or your phone? So not simply just avoiding reusing the gloves or taking them off improperly, but things like what should you avoid touching or be cautious of the precautions you take when you are wearing gloves?
Well, the first thing I want to say that you want to be cautious of, and is touching your children and touching other people. That's the first thing, because I think we are touchy, and especially in my family, we're touchy-feely people. I mean, we hug, and and so that's the first thing to avoid, is to say, wait a minute, let me get this off, let me change my clothes. So I think that's very important. That's the first thing we have to remember to avoid. Secondly, in terms of with your keys and coming through the door, while I think it's very important that you sanitize, and because I've become such a fanatic. Once I get in the house and I start taking everything off, I go and I have a bleach and water solution that I use. I spray the handles of the doors every day. I also clean my keys. I think that's very important also, to keep your keys clean, and the doorway on the knobs on the outside and the inside of the doorways. And then I kind of follow my steps where I've been. And so I go back into the bathroom and I clean the bathroom with the bleach solution, because I've washed my hands, but in the interim, I've also had my elbows on the sink. I've also had my wrists on the sink. And so although I've washed my hands, I did not wash the outer rim of the sink. And so I've gotten in a habit of making sure that I clean those areas. And again, the things in taking off, I don't even hang my coat up in the same area where I hang my other coats. And so I take out the Lysol and I spray my coat. So I kind of have gotten in a habit of spraying the things that I've had in my hand with either Lysol or cleaning them with bleach. So I think the messaging should be, after you take off your gloves, trace your steps or have as little contact with items as possible, and to go and clean up, go back behind and clean up where you were. Make sure that you go back to clean your handles, your sink, and your keys.
And if I may, this is Melissa. You don't really need to wear gloves. It's really about washing your hands and washing them appropriately, and not touching your face or touching other people. And that's it. I mean, because if you wear gloves, you have the tendency to cross-contaminate it even more, and not, because there is a science to wearing gloves. And really, I would keep the gloves for people who work with patients and the grocery store workers, if they have to wear gloves because they're touching money or touching groceries to stock things, but then they have to learn about the safe practices. But just for like everyday person type of use, I think you just use your hands and you wash them appropriately. I think that makes much more sense, because otherwise it's too confusing.
I have two more questions for you, and then we'll see if Melissa has any more audience questions, because we're getting close to time. So you mentioned that you are a hugger, you like to touch your family, and I think that it's important to note that we have cultural differences across our families. So for instance, I have Greek in-laws that they normally hug and kiss each other on the cheek, which is probably the worst thing you could do right now, to be that close to someone and share air. So how do you think cultural differences factor into this outbreak?
Oh, it's a challenge. That is such a huge challenge, because again, it's one of the, you want to hug and love on your family members. And I can tell you that while my mom was going through this, that was a really difficult time, because I wanted to reassure her that she was going to be okay. And she had a moment where she just screamed and was so devastated. And I was so heartbroken, broken, that I couldn't hug her to give her that reassurance. That was very hard for both of us. And so I would say that those that are having those cultural, I don't want to say issues, but these are, this is part of your culture, to put aside that for a moment and think about your safety, and think about how deadly this disease can move. It's different from person to person. And so I think, just as my mother is recovering, and she's doing better, and she's, she had a very mild form, I'm so grateful to that. It doesn't mean that the next person or someone she may have touched will have that same experience. So we need to make sure that we are sharing that. Although this is something that you're used to doing, it is something that you have to temporarily put on hold and say, I love you from a distance, and find creative ways to continue to share that love without having to physically contact that person. But just because you're not hugging and kissing does not mean your love has diminished. Safety right now is important. Safety.
Thank you for sharing that. And I can only imagine how difficult that was for you. So to end on a somewhat positive note, what is something that you are hoping comes out of this situation? So for instance, I think one possibility, one positive thing that might come out of this is some destigmatization of mental health issues. Some people are experiencing panic attacks for the first time. People are starting to admit that they're not doing fine when people ask, how are you? And so what is something you're hoping might change because of this pandemic?
Habits. we are so comfortable with, our day-to-day activities and our day-to-day life that we have developed, habits that, we don't think that we should have, you think washing your hands is a message that you shouldn't have to give. But to be honest, when we think about it, we come in and out of our daily lives. We come in from work, we come in from being outside, we throw our keys in our coat and hang them up, and then we sit down. We don't take off. And I remember years ago, and I didn't understand when my great grandmother used to say, go and take off your outside clothes. I didn't understand that at the time. And so now during this time, I'm recalling the things that my great grandmother used to tell me: take off your outside clothes, and go wash and, change your clothes, because you don't know what you've come in contact with outside. And I never understood that as a kid. I didn't understand what she meant. And so in her infinite wisdom, and having experienced, her experience in life, of the, different pandemics in her time, that's where her knowledge came in. And so now these things are starting to make sense of taking off your outside clothes before you sit on your couch, before you sit on your bed, before you interact with your family members. So I think developing habits now of cleanliness, of remembering that we have to be careful of what we're bringing into our household and who we're interacting and who we're engaging with. So, and I'm hoping also that taking better care of ourselves is something that we develop.
Thank you. Melissa, did you have any other questions?
No, I think what Candace said was amazing. And thank you so much, Candace, for your time. And thank you everyone for joining us. But I do want to say what this is teaching us is that care for yourself, care for others, care for every human is super important to society and for society's function. And then in terms of what we can do from a research standpoint, a healthcare services standpoint, healthcare provider or organization standpoint, is to remember that we got to get the messages and the right education and be consistent about it on the ground in the context of the actual people we're trying to help. Not just put something on a website, not give a list of resources. Those are cool and fine, but it's not hitting the right spot to make the impact. And so that's why we wanted Candace on today, so that, she's on the ground as you can get, and she is real as you can get. And that's what we really need more of, that connectivity, instead of being in the ivory tower saying, here's a list of resources, we'll put it on our website. So thank you all. I hope you join us again in a few weeks.
Thank you. Thank you for having me.
Thank you. A virtual hug.
Yes.
Yeah.
Thank you.
Wow.
Thank you.
Wow.
Thank you.
Thank you all. Have a good day.
Thank you all. Bye-bye.
Bye-bye.
Bye.